Well, I was going to start by saying good afternoon, everyone, but I think it's more good evening now. Apologies for the delayed press conference. Tynwald's sitting went on a bit longer than we expected. I want to begin by thanking all of those who stood in tribute yesterday to the members of our community who have lost their lives to COVID-19. The 1 minute silence was impeccably observed, particularly by the Isle of Man Constabulary and in the parish of Arbury, where the deaths of Richie Lloyd and David Corkish are most keenly felt. During that solemn moment of reflection, my thoughts turned to the words of the two families who are experiencing unimaginable pain. At a time of great personal loss, they urged everyone to stay strong and do the right thing, so that others don't suffer the same heartbreak. And as we emerge from the Easter holidays, I am encouraged by the fact that the vast majority of our residents are continuing to heed that advice. People have been self-disciplined, good-humoured, creative and conscientious. The minority who have endangered the community with their selfish and reckless behaviour have been dealt with in a robust fashion. Several arrests have been made. 2 offenders are currently in prison. The police dealt with numerous reports of people flouting the law over the Easter weekend, holding house parties, meeting friends in parks and on beaches to drink and socialise. The irresponsible actions of the few threaten to undermine the sacrifices being made by the many. Complacency will cost lives. This wicked virus does not discriminate. Youth does not offer a defence. Neither does wealth or status. COVID-19 impacts all walks of life. That is why we must hold our collective nerve and we must stay firm. I will say again, listen to the public health experts, listen to the police, listen to the grieving families. Save lives, stay at home. At this point, I would like to give you the latest testing figures. Total tests undertaken is 2,122. Of which we have had 2,064 tests back, meaning we have outstanding 58 results. The total number of confirmed cases now stands at 254, and the current number of confirmed hospital admissions with COVID-19 stands at 15. During today's virtual sitting of Tynwald, I set out how we are planning to respond to the COVID-19 pandemic in the short and medium terms. We are looking to the future. We are exploring the possibility of a phased return of certain sectors of our domestic economy, those that can safely comply with strict social distancing rules. However, now is not the time to relax all of our efforts. The clinical advice is clear. The current restrictions must remain in place. We must protect our community, flatten the curve, and ensure that our health service is not overwhelmed. These objectives have also been upmost in our minds during the planning to repatriate island residents who are in the UK or further afield. We recognise that we can't help everybody. It is a highly emotive issue, and people will be disappointed, angry, and upset. Our thinking has once again been informed by advice from our clinicians and policymakers. The strict guidelines are in place for a very good reason. They will not only protect those wishing to return to the island, they will safeguard our wider community and our health service. The first returning residents that met the requirements will sail to the Isle of Man tomorrow before being transferred to the Comus Hotel to begin a 14-day quarantine period. This process will remain under constant review. I will shortly hand over to Catherine Magson, the Chief Executive Officer of the Department of Health and Social Care. But first, in my capacity as Minister for Health and Social Care, I want to say thank you, make an appeal and ask for patience. The thank you is to our healthcare professionals who continue to display great devotion, courage and compassion. Our frontline colleagues are working tirelessly to deliver the highest standards of care to all our patients in extremely challenging circumstances. Together with key workers in a range of other essential services, these men and women are spearheading the island's response to this pandemic. Thank you on behalf of a very grateful island nation. The appeal is to the island's amazing group of blood donors. We need you to keep your appointments. Giving blood saves lives, and it is essential that donations continue. I appreciate that you may be feeling concerned or uncertain. I can reassure you that enhanced safety measures are in place and you will not be breaking any stay-at-home rules. Giving blood is classed as essential travel. Please continue to play your part and help our health service at this difficult time. My plea for patience relates to the rollout of glucose monitoring systems for people with type 1 diabetes. As people will know, we had intended to make the sensors available to eligible patients from the beginning of this month. However, as I am sure people will appreciate, our resources are focused on the island's response to the COVID-19 pandemic. Please bear with us. We remain fully committed to the implementation of the glucose monitors and will review the situation in 3 months' time. And I would now like to introduce Catherine Magson, who's Chief Executive Officer of the Department of Health and Social Care, who will provide further insight into the work taking place across the department. Catherine.
Good evening, Minister, and thank you. So I'm just going to take this opportunity to explain some of the high-level assumptions behind our planning in DHSC and the graph position that everyone will be now very familiar with. Clearly, everybody will know the infection rate is exponential. It grows according to a standard equation, which we describe as the RO. We have taken into account in our planning the population of the Isle of Man, the infection rate, the percentage of symptomatic cases, potential fatality estimates, and actually all of that information is updated and improved on a week-by-week and even on a day-by-day case basis. So we believe we could potentially get 2,700 symptomatic cases on the Isle of Man. If they all present over a couple of weeks, we know, and we've talked about through various press briefings, that we will be overwhelmed. If they present over a couple of months, we may cope. So that's why we've been recommending, and the politicians have accepted and agreed the strategy around social distancing, self-isolation and lockdown. And that has been the entire aim, to try and attempt to reduce the transmission rate of the virus, to suppress the spread of the virus and allow health and social care systems to cope. And ultimately, time for us to build capacity, particularly in Nobles hospitals, in the community, in primary care and in intensive care. So I'd like to just look at the first graph, if I could have that put up, please. So we've looked at 3 scenarios. As I've said, I've mentioned this is around the world. It's a learning from around the world. It's a continuous iterative process. It is a planning tool. It's not an exact science, but it's that tool that we've used in which in order to be able to plan as far as DHSC is concerned, and also in which we've made recommendations to the politicians in order for us to be able to manage that demand and time to build the capacity that we need. So looking at the 3 scenarios which you'll be familiar with, but to give you some further detail, the first scenario is the blue line, which is a 29% growth. And that is not the scenario that we want. That will be without any unsuppressed measures. The second scenario, the red line, is what we believe and we're using as our planning assumption. We believe it's a realistic planning assumption, and it's based on a number of different scenarios from around the world, but predominantly the German model. And that is a 12% growth. The third line is an optimistic expectation, and that is actually where the rate of infection will be halved. In all of those scenarios, we've looked at where the peak capacity would be in place at Nobles or in the community or in other parts of the system, and hence the measures that we've been proposing in order to be able to suppress the curve and build the capacity for our system. So those pictures are improving on a daily basis. We get more and more information on a daily basis. We look at science from around the world, and we try to predict where we are. We try to look where we are in that curve and to give the appropriate advice. So that mathematical model is correct. The assumptions vary day by day, as I've talked about, but it really is based on the best available evidence as it develops. But it is too early for us at this stage to know where we are in the curve. There is a random variation in small numbers, if you've seen, due to the size of the population. And it might look like we're varying from the model, and we may not be. However, as a department, we are optimistic. If I could show the second curve now, the second graph, please. This is the latest position. It shows that optimism that we have as a department. We do know that in all these scenarios, health and social care will, however, be full to capacity, but we're aiming to minimise the level of avoidable deaths by flattening the curve and managing that capacity throughput. Meanwhile, key part of this is it's essential for us to enhance the community and primary care approach. A key assumption behind a lot of this planning is a significant proportion of our patients are managed in the community, i.e. not in hospital and not in ITU. This is based on patterns elsewhere, but it is not an exact science. So at this stage, we believe we will be able to predict where we are in the curve and identify the trends. And as a result, we'll be able to do that on the 23rd of April. Therefore, the Council of Ministers have agreed that the current measures should stay in place for one further week. Our reasoning behind that is because at this point, will be 2 weeks from that planning, that middle line around that realistic expectation from the peak. We will have more statistics and the numbers are still relatively low currently. The incubation period of the virus can be up to 2 weeks, and therefore it will take 2 weeks from implementation of the measures for us to really see the true impact. And ultimately, we're able to understand the impact of the repatriation and rescue arrangements on our health and care services. But we are optimistic. You can see that from the graph. You can see that from the trend that's coming through. And therefore, I must finish by saying a big thank you. A thank you to all DHSC, all to health and social care staff. A thank you to all those that are helping us, the voluntary sector, the redeployed members of staff within the government, the private sector, but most of all the community. We are really clear that it's the community that's making all the difference. Thank you, Minister.
Thank you, Catherine. And I will now take questions from the media. And first up today, I've got the BBC and Alex.
Good evening.
Good evening, Alex.
I'd just like to start by asking you about the logistics of repatriating these individuals starting from tomorrow. Can you give us a number of how many will be arriving tomorrow, and will they be arriving on separate sailings or just the one?
It's just the one sailing, Alex, and off the top of my head, I think it's 29 individuals that are on that sailing. The logistics, of course, has, as we've discussed at previous press briefings, been a challenge. It's about ensuring there's social distancing on the boat and that this can be done in a clinically managed way. There's been an awful lot of work going on jointly between the Department of Health and Social Care and also DOI to try and ensure that we can actually do this in a proper way, a managed way. And I don't know if you want to come in with anything, Catherine, further to that.
Yeah, so the individuals will be collected at Manchester. They will then be a health assessment, a simple health assessment will be done by ourselves, by our team. We've sent a member of staff over there to do that. And then will be taken by coach to Heysham, and they'll be travelled on a boat, on one boat, as we talked about, where clear social distancing measures will be in place. There will actually be 2 coaches to allow them to ensure that they've got clear enough space also within the coach itself as well.
Thank you. And just to clarify, they're coming back on the Manannan, are they?
Yes, I believe so. Yes.
Okay.
Yes, just to come in on that, because of course initially the plan, as people will be aware from the previous press briefing, was the Ben McCree, but the Ben McCree also deals with freight, it also deals with oxygen supplies coming into the island, so it's important it can be kept free for those sort of supplies. So we've done a clinical assessment of the Manannan, and the Manannan is being set up so that people can come back using that boat.
Thank you. And just to move on to sort of the second point that you raised towards the end of the briefing there, at least another 9 days we're talking here, that suggests a change in policy may come after those 9 days. 9 days to many of us will sound alarmingly early. Is a change in policy really likely after that point?
Well, Alex, just before I bring Catherine in on that, I need to stress again what I've stressed at many press conferences, that we do things stage by stage. So we are looking, we believe we need another week to get all the data together to look at where we properly are. People should not, however, be reading things into that. It is very important we don't speculate and think, oh, well, that means it's another week and then it's all over. That's not the case at all. We have to do things in a measured way. The additional week is to allow us to collate that data together, find out where we are on our curve, and that will then make the decision as to what the clinical recommendations to myself and the rest of council and ministers are about the way forward. So we shouldn't be reading too much into that at this stage. Catherine?
Yeah, no, I completely agree. Our strategy, certainly within DHSC, as we know, and the politicians have been supporting the measures accordingly, is around the containment and the suppression of the virus spread. We've been focusing while that suppression is allowed to take place then, and the delivery of the care and building the capacity that we need. And even in a week's time, all we were saying is we will be able to predict, therefore, where we will be. We'll have much more data, we'll have much more statistics. We believe we'll be about 2 weeks from the peak of the curve at that point. We'll also be able to see the impact of the repatriation and also the incubation period of the virus as a result of the measures that have been taking place. So our strategy doesn't change, and ultimately definitely doesn't feel like that on the front line.
Thank you both.
And next up, I have Isle of Man Newspapers and Adrian. Good evening, Adrian.
Hi, David. You okay?
I'm very well, thanks.
I just want to touch on the issue of compassion in relation to the returning residents. It was a feature of the debate in Tynwald this afternoon. There's no doubt, I think, that all these people will be very keen to ensure their own safety, the safety of their families, and the safety of the other residents in the island. But we had a situation here, didn't we, that in emergency regulations, that only those who were going to be, who were staying with their family, those who were staying with their family and friends wouldn't be able to even apply to go home. And I know subsequently there was an amendment and that was thrown out. But where was the compassion in that idea? Why did this even come up? It just gives the impression of kind of policy on the hoof, really.
Well, the first thing I can say, Adrian, is there's been no policy on the hoof. Everything has been very much looked at in the round. There's been lots and lots of decisions and very difficult decisions that have had to be made, particularly in relation to returning residents. Let's not forget that the island had to enforce a full border closure to everyone. Now, you mentioned about compassion, and compassion is crucial at the heart of this. I have had people contacting me exceptionally upset, who have been stranded abroad through no fault of their own. They may have been in countries that have gone into lockdown. They've not been able, for whatever reason, to get even back into the UK. Now, the amendment that was put forward today, it was accepted, and I should say it was actually supported unanimously. So it wasn't a case of things being thrown out. It was supported by council and ministers as well. The thinking behind the people staying with the family is that is generally a safe environment. And the worldwide advice, even from the World Health Organization, is if someone is even in a different country, if they are in a safe place, they should stay put, because they can put themselves at more risk by travelling during this time as this pandemic spreads around the world. This isn't something confined to the UK or confined to the Republic of Ireland. This is something that is coming as a wave across the entire world. So the advice is to stay put, and that is what that was based upon, because generally if people are staying with friends and family, they can, and particularly family, they can stay for a prolonged period of time, and it is a safe place for them to be. Tynwald appealed to council and ministers to show, as they've said, some more compassion in that regard, to reconsider that. We did reconsider that during the sitting, and as I said at the time of the amendment, I hadn't seen the amendment until it was moved. I was happy to support that amendment, and went through unanimously in the end between council and ministers, between Keys, council and ministers and legislative council. Everyone supported it, but there is certainly no policy on the hoof. I hope people who've watched these press briefings can see very clearly that at every stage we've done something, we've had a plan. So when we had our first case identified on Ireland, when we had our first bit of community transmission on the island, all along we have been building up that plan. And as we have just announced today, that extension of a week is to allow us to get more data so we know where we go in the future. I don't know if you want to add anything on that, Catherine?
No, I think our approach originally was actually it was very much starting with the theme of compassion, is to support those residents who were actually stranded. That's actually how it all came about. What would the clinical body support in its recommendations to Council of Ministers in order to do so and support individuals? But it's not even just through this route that we've also been supporting people. We've been doing many back-to-back arrangements with primary care in the UK to support people with their medication, and also ultimately further afield. So there's a lot of data work that goes behind the scenes, even with people who are currently unable to get back to the UK and unable to come back to the Isle of Man from a compassionate perspective in the work that we do across DHSC.
Have you got a second question, Adrian?
Yeah, the connection cut out when Alex was asking his question, so I hope this wasn't his question. But the original plan was to bring the returning residents home on the bed, and it's now going to be the Manannan. They were going to be in cabins, weren't they? So what steps are taken to ensure that there's the safety of the returning residents on the Fastcraft?
So, Catherine, I don't know if you want to pick up before I come in.
Yes, so we will ensure that everybody socially distances. There's plenty of space to do that. They can carry up to 500 packages, so we're comfortable that that's the case. And we've worked closely with DOI to ensure that that is the case.
Yeah, so just to add to that, there has been full clinical involvement in relation to how this would work. It is possible to do it on the Manannan. As I pointed out at the start, I think off the top of my head, it's 29 people that are coming on the sailing tomorrow. So the boat, with the size of it, there is more than enough space to accommodate those individuals. Okay, next up, I have Amanda from Jeff the Mongoose.
Thank you very much, and thank you for sharing more information on the data and curves today. Obviously, the island is smaller than the UK, but we know that the government is working closely with Public Health England over the pandemic. Are we getting specific guidance from their virologists and epidemiologists on our data and curve projections, or are we seeking out our own experts for advice? And if so, when will we be hearing from them at future updates?
I'll let Catherine pick that up first.
So no, we are obviously following and a part of the Public Health England system, for want of a better word. Our Director of Public Health joins a daily conference call with the Chief Medical Officer, and actually our microbiology team also have a daily conference call. So there are huge links. In fact, it could go beyond from an emergency planning perspective and so forth. But actually all the work that we have done is through our local expertise, but we've also had help and support from many different industries, the Department for Enterprise, but ultimately we're best placed in order to be able to model the best scenario for the Isle of Man. So we've done a whole suite of research. We've spoken to many different countries ourselves. We have used some epidemiology advice. Clearly, we've got the Director of Public Health, and we are sourcing what we can in order to build our appropriate picture. And at the moment, that position seems to be holding, and that's the basis of which we're planning.
And I think that's the crucial point to make, Amanda, is that what we are doing is what is best for the island. So we are looking at what's best for the Isle of Man. So although we feed into Public Health England, we look at their advice, we look at what they are doing, we will take the bits that are relevant, we feel, to us. Because one of the other things that has to be emphasised is, of course, we are on, at the moment, a very different part of the curve to the UK. Particularly the UK stopped community testing effectively. We didn't. We carried on with our community testing. So we're in a different space in that regard. So while there's some things we will mirror from Public Health England, there are other things that we will be doing that are unique to the Isle of Man, because that is unique to our situation here on Ireland.
Thank you. And so just to clarify there, so are there any epidemiologists or virologists on our Manx team?
So we have used local support from the private sector, and clearly we have our Director of Public Health as well. So yes, we have. Yeah, we've used a variety of different sources. We've not said no to anything, and clearly we've taken as much evidence as we can from around the world to support the idiosyncrasies of the Isle of Man that we need to make sure that works for us. And we'll continue to do so. We will not stop. You know, we would welcome any support that we can have, and we're constantly horizon scanning to try and learn from elsewhere and implement what we can as the best practice. And the Minister's just talked about our approach around tests, trace. That's a fundamental part of our strategy and will continue to be the case.
Thank you very much. And for my second question, a new coronavirus centre for testing samples is due to open on the island this month. Is there a confirmed opening date, and how are lab technicians being sourced at such short notice to staff it?
I'll let you pick that up, Catherine.
Yeah, okay. So we're actually on track to deliver that by the end of this week. So we still aim to open up on Monday next week. So it's our own microbiology team. It's our own lab testing. We've actually been what we call double swabbing now for about 4 or 5 days. So we're checking and double swabbing, checking that the tests that are going to Manchester are the same results of what we're getting. It's part of the statistical analysis we would do before we were able to switch it on. We're confident of that. I receive a daily update on it, and I believe it will be on track. But we won't do a go no go decision until Friday on that. But if we're assured around the position, then we will go ahead. And in that case, we believe we'll then be able to do up to 220 tests a day.
Brilliant. Thank you very much.
Okay, next up, it's Manx Radio and Tim.
Yes, good evening. Care homes been very much in the news in the UK today. We have obviously a case at Abbotswood and Ballasella, and last time we checked, there were 2 confirmed positive tests, 5 being tested. Can we just have an update on care homes, as it's been so much in the news today?
Well, before I bring Catherine in to talk around care homes, I need to emphasise again what I've said at previous press briefings. The department has been massively in communication with care homes across the island. We've been giving them PPE where appropriate. We've been advising them what PPE is appropriate when. There's whole protocols that have basically been developed and been given to the care homes around what they should be using when and what's appropriate for their residents. So there has been a huge amount of engagement with the care sector. Over Easter weekend, I actually spoke to 5 different managers of care homes who actually proactively contacted me to say that they were happy with the way the department was engaging, and that they were actually very glad that we had engaged in a different way to, say, other jurisdictions such as the UK. They felt we'd been very positive and we'd been very proactive in our approach. So those were welcome calls for me over the weekend, and I'll bring Catherine in.
Yes, so the Minister's already talked about this support for care homes and residential homes, supported living, any sheltered housing, has been going on for some weeks now. We have a community team within what we call our command structure that's dedicated to support the community, which clearly includes nursing homes and residential homes. So the voluntary sector have clearly been a big part of that, but not only that, also our team, our community nursing team, and we've had a dedicated team of people supporting care homes, not only for the PPE that the Minister talks about, but doing care calls to make sure that they feel that they've got the appropriate support, they've got the appropriate training, any further help that they need, anything that they're unsure of. Those care calls, we're about to start another round of them at the moment, but at the moment the feedback has been generally positive. And if we do receive any requests for help, then I'm comfortable myself that we action those at great speed. Only one evening this week, somebody said we're running short of PPE, and then the team were out that evening delivering it for them. So the lines of communication and channels of communication are strong and will continue to be the case. Clearly, the frail and elderly and the residents of care homes are a key area of focus for us. I talked on and touched on earlier that actually a lot of our modelling is underpinned by the fact that most individuals will be able to stay in their own home, which includes nursing and residential homes as their home, and we will care for them there. Clearly, that will involve the role of GPs, will involve the role of district nursing, will involve the role of the voluntary sector, and we continue to develop those pathways and that capacity within the community. I am very well aware, and everybody will, and you've touched on particular care homes that have needed more support. We as a department have been providing that, and as of yesterday, we have now stepped in and are now running one care home. So the department have needed to do that, and we will continue to provide the support to care homes and residential homes as the Minister describes.
Can I just pick up on that? Is that because we heard reports that there are a lot of staff off as well? Is that why the department's had to step in?
So there are a variety of different reasons, and clearly that will be a confidential set of reasons between the department and the licensee. But we felt it was appropriate for that time for the safety of the residents to step in, and we have done that as of 5 o'clock yesterday evening.
I think the
Thank you.
important point on that, Tim, is the department is there to provide support, and we are providing active support for care homes across the island. And I think that's the absolutely fundamental point to make.
And secondly, Discover Diving made masks for the good of all, received a shout out for this work as one of Howard's heroes in the early days. The company does rely on tourism, but couldn't get any form of financial support, and they've now closed. We've had a lot of comments saying this doesn't seem very joined up or compassionate.
I'm not aware of that, Tim, and that's really a question, obviously, outside of my remit as health. I'm not aware of the situation with that particular company. Okay, next up I've got Rob, 3FM.
Good evening, Minister. I just wanted to, my first question, quickly ask about the repatriation process with regards to the quarantine facility at the Combs Hotel. Could you just clarify for us again how much people who are having to stay there are having to pay to do so? And also, where that cost has been worked out, what are those costs actually covering specifically?
So the costs are covering the accommodation, they are covering the food that people will be receiving, 3 meals a day. They're also covering the travel back to the island as well. And obviously the government has security costs and everything else around this. But the important thing to emphasise is it is capped at £1,000. And also I need to emphasise it is a contribution. The amount that we get from people who are quarantining is not going to cover the full cost to Isle of Man government of this quarantine centre. But also the key thing, which I emphasised again in Tynwald today, is that people who do have to pay will be able to pay over a period of time. Unlike some jurisdictions, we are not going to ask for the money up front. We are not going to withhold passports or anything else that I believe at least one jurisdiction has gone down the route of doing. We will allow people to pay over 12 months or more if they can't afford it. And also, of course, to emphasise again, anyone who is on income-related benefit or crucially qualifies for income-related benefit will not have to pay for it.
Okay, thank you. My second question on a slightly different note regarding the figures of presumed recovered cases. Before I ask my second question, I'll just draw your attention to something we've been told from someone in Germany. They tested positive for COVID-19, went into self-isolation. Now, their testing routines are different to here. They were tested a few times whilst in self-isolation to check if they still had the virus. Crucially, after 3 weeks of self-isolation, their latest test still came back positive. Now, the current quarantine here is for 2 weeks. So how do we know that those presumed recovered, if this is a case that it is running into 3 weeks where someone can still carry the virus, how do we know that those presumed recovered are or aren't infected, and how do we manage that risk?
Before I bring Catherine in on this, most worldwide studies, there's been lots of studies now from around the world, show that if people are mild cases, then the recovery period is up to 14 days after symptoms first show. Those are mild cases, and those are the ones we include within the presumed recovered. We don't include, for instance, the serious cases in hospital within that figure. There's a different measure there in terms of their discharge and their return after recovery. We are doing it off the mild, and that is exactly why we use the presumed recovered as well. I mean, a prime example in the UK is the Prime Minister Boris Johnson, who on day 10 of his recovery, his symptoms changed, he ended up getting admitted to hospital, and he was past the 14 days. But most of the worldwide tests show clearly that most people with mild symptoms, it's 14 days. The UK has taken the stance that people showing symptoms can generally go back about their daily business after 7 days. We haven't taken that stance. We've gone off the World Health Organization studies around the 14 days, but I'll bring Catherine in.
So yes, I completely agree. It's far too early to say. There's lots of conflicting evidence, I have to say, and individual specific cases, one of which you've referred to. But the minister's quite clear. We chose 14, have stuck with 14. That is longer than the UK position. And it is the presumed recovered. It doesn't take into account any inpatients, and it certainly doesn't take into account anything that's within DHSC more broadly than of support. So we are and I would expect that individuals, if they are feeling at that point that they're unwell, then they'd clearly be contacting other parts of the health and social care system, and we would be supporting them accordingly. And if there's any evidence as part of the daily contact tracing calls that we're making for individuals, they're still feeling unwell, then the advice would still be is that they should continue to self-isolate. So it would depend on a case-by-case basis. Clearly, there's the vulnerable, the very vulnerable, and different cohorts of patients that we're supporting. But the advice generally, as we said, is clear: is that after 14 days, then you can return and are presumed recovered. Our approach, I just wanted to touch a little bit on how we're focusing on essential workers, because clearly, as best as we can, we try and get as many people back to work as quickly as we can, especially when they're key workers. We don't have an antibody test. The evaluation position around antibody, we will follow Public Health England advice here, is that this is still not at a position where it can be rolled out. So we're in the process of rolling out a new essential worker testing strategy, which we'll do across government. But we'll be looking at where we'll have individuals who've had a negative test. If they're a key worker, then they have another negative test 24 hours later, and then they'll be able to return to work. So that's a process that we're undertaking at the moment. It's part of our plan around in-house testing, and when we have more capacity on island. So all of these things will be worked up to try and improve the level of testing. And as I've talked about earlier, we'll be moving towards nearly 220 a day as quickly as we can, and that will make another step up, an enormous difference in what is already probably a relatively world-class level of testing at this stage.
And just before you go on to your second question, Rob, if I can also add, of course, the advice we've put out for day one around the 14 days is if people have not improved or their symptoms have got worse, they should be contacting 111 again.
Yeah.
Well, just to quickly clarify there, the case that I spoke about there and you've just responded to, that was also a mild case, and there were mild symptoms with regards to that. If there is evidence in a case like this or around the world, is there maybe not an argument for a more routine and more regular post-quarantine check to be done, regardless of how mild symptoms are?
Well, the first thing I would point out is in the case, I think I saw something very briefly about it, is case in Germany, I think, in relation to the one you're referring to, Rob. That particular case, the person's symptoms had not cleared up, and our advice is quite firm on that if your symptoms have not cleared after 14 days, you should contact 111. So it wasn't a case of their mild symptoms went away, they tested positive, the symptoms were still there. In terms of our testing strategy, we base that on the robust advice of stuff that is coming in from around the world. And while, as with any viral outbreak, there will always be exceptions to the rule, because we are all human, we are all unique, we are all different, and the way our bodies interact with viruses is very, very different. The vast majority and all of the studies show that most people with mild symptoms will recover after 14 days. If people get to the end of the 14-day period and they are no longer showing symptoms, the advice, quite rightly, is that people can then go back around their daily business. As I point out, different jurisdictions have different measures. In the UK, it's 7 days. We have robustly stuck with our 14.
Thank you very much.
Okay, MTTV and Paul.
Hello, David and Catherine. Thank you. We've been hearing from a person who regularly gives blood, and you've been mentioning tonight you want your blood donors. In the UK, you can do it. I think it's that he's a gay student, and over here you still have this sort of throwback, I guess, from the HIV scandal that they can't give blood here. Is that actually correct? And should that not be changed if he's hitting the criteria, which I know there was, safety involved on being able to give blood?
From the top of my head, Paul, the regulations were due to be changed, and I thought, unless I dreamt it, I did move through an amendment through Tynwald to change the regulations on that a few months before all of this current pandemic around the world emerged. But I will have to double check on that. But I know certainly it was the department's intent to change the regulations to allow that. But I had a feeling that before the pandemic, those regulations did go through Tynwald.
Okay, thanks. Also, you may have followed the story today about this student, 3 years in university studying to be an occupational therapist. She submitted to re-enter the Isle of Man with all the forms. She's discovered she's got to pay £845 for her isolation accommodation. Now, she is seen as a key worker. She's going to start work at Nobles Hospital following her isolation, but she's wondering how she's meant to afford that money after being 3 years as a student. And just to follow that up, I spoke to her mother saying, to add salt to the wounds, she was put on the second day of the new services, but she can't make that because she's got to stay where she is in a placement for her graduation and other things. And then she's then been told she won't be able to travel on any other sailing necessarily because she's declined the one that they've offered her. Your comments?
Well, Paul, in relation to that, if she is a key worker, then she would be able to apply under the key workers exemption for coming into the island. So I think that needs to be clarified because she clearly hasn't met the key worker criteria. She's not being considered under that. In terms of coming back, if she's actually in receipt of a maintenance grant at university, then she doesn't have to pay. That's one of the other exclusions that's in there. But if she is saying she is a key worker, then she should be applying to Cabinet Office for a key worker exemption, because the process you have laid out that she's going through at the moment is to do with the repatriation of residents abroad. And in terms of the boat and sailing, I've certainly not heard of any instance of anyone being refused, saying you can't come back later because you can't make that sailing. I think she needs to contact the Cabinet Office and explain why. Catherine?
Yeah, no, I am actually aware of that case. She has contacted the Cabinet Office and it's just arrived with us to look at. So we're looking at her key worker status, so that's the next step.
Thank you very much.
Okay, I've got Josh and ITV.
Thank you, Minister. I hope you're well. Good evening. Are you able to give some insight into the health checks that returning residents will have before travelling to the island?
Catherine, do you want to pick up on that? I've already explained it in Tynwald this afternoon, so over to you.
Okay. So effectively, it's a temperature check. We're sending one of our senior nurse is to go over. They're asking questions predominantly around if they were positive, when were they positive, and if they've been in contact with anybody who has a contact traced effectively who has been a positive case. So they would need to show evidence that is the case, but other than that, it will be a simple health check.
Given the Minister, I know you previously stated a temperature check at Douglas Sea Terminal wouldn't be very effective to detect coronavirus. Why does the department now feel that a temperature check is sufficient enough to bring people back to the island?
Well, one of the things we've got to say, Josh, is when we are bringing people back, we are bringing them back into quarantine, which is very, very different. Whenever we've talked about temperature checks before, and we did a long interview around this, I think, before all the current measures came in, temperature check, obviously, people showing a fever is one of the symptoms of COVID-19. That isn't the case in all cases of people. And also, it doesn't work for those that are asymptomatic. So temperature checks are very limited in their ability. But obviously, it is one of the main things that emerges with people with COVID-19. So we are doing that at the port, and anyone with a fever will not be allowed to travel. To be perfectly frank, if someone is showing a fever, I would hope they wouldn't attempt to travel anyway, because the safest thing for them to do is to stay put and self-isolate where they are. So that is the key difference. We are bringing people back into a quarantine facility. Whereas when we talked about this previously, the temperature check was in relation to why can't we just do a check at ports and keep the borders open and everyone flows in and out as normal. So the context is different. Catherine?
Yeah, so I completely agree. We looked at long and hard at the different options. This was seen as the most practical option. And as the Minister says, the recommendation for us was around the strict quarantine. We are bringing people in from a much higher viral load around the UK, and that is a significant risk. It is significantly different. And that's why our recommendations included the quarantine restrictions in the first place.
Okay, thank you.
Okay, and then last but not least, I've got Chris from Energy FM.
Good evening, Minister. At every stage you've acted, you say you've had a plan. We heard not too long ago that the tourist industry was one of the worst hit by the restrictions imposed. How was it decided that those being brought back to the island would be accommodated at the Comis Hotel?
Well, there were several things that went through. Firstly, the security of the area, because we need to secure it needs to be an area that we need to be able to secure. So a semi-isolated area. There was also the size of the hotel as well, and the ability to have grounds to allow people to exercise, because one of the things we didn't want to do is just confine people to their rooms entirely for the 14 days. So all of those were measures that were taken into account, along with the fact of what of an area that we can keep clinically safe, because that's the important thing as well. We have a duty to those returning to ensure that there isn't some form of mass contamination within the area. So it was all done around those things and the clinical recommendations that flowed from them.
And will the £1,000 fee that these people being brought back, that they're asked to pay, will that foot the bill as to how much this is costing government?
No, it won't, as I stated just earlier in this press briefing. The costs are much wider than that, but government has decided, and I should say, to cap it at £1,000. So as Paul referenced there about a young lady looking to come back, the figure she was quoted to it was £840. I need to emphasise again, the £1,000 is a cap. And again, the key thing to point out is those that are on income-related benefits, or crucially would qualify for income-related benefits, won't have to pay it, nor those who are students in receipt of a maintenance grant. And equally, we will allow, unlike some other areas of the world, repayment plans over a substantial period of time.
Were any other options considered, or was it a straight choice for the COMIS from the Council of Ministers?
Lots of different sites were looked at. I'm not going to start reeling off names of sites, but like I say, the key thing was from the point of view of security of the site, of being able to give exercise to the people who are in there, and also space as well, having enough space for them to be moving around, because they will be spending a substantial amount of time in the rooms. And also, of course, we had to look at the way any particular hotel or centre would be staffed, how meals would be delivered. All of that worked into our equations.
And I apologise if this has already been asked. The connection hasn't been the best for myself this evening, but how will that work? Will it just be medical staff and healthcare workers on site, or are those employed by COMIS also going to work?
Catherine, I'll bring you in on that if I may.
Yeah, so there'll be no need for us to have medical staff on site unless individuals need swabbing. So if they are showing symptoms of, and if they do arrive past the temperature checks and the other health questions that I've referred to this evening, then they will, and they do start to show symptoms, then they will be given information that means that they have to phone 111 in exactly the same way. We will then organise a swabbing team to go to them and take the relevant swabs, but they will remain in quarantine throughout that period, and we'll give them relevant advice at the time. So other than that, they will be given advice around how they must clean their rooms. They'll be given the equipment to do so. They'll also be given advice around laundry, bedding, and so forth. So yes, so all that is planned and meticulously done so by the DOI and DFE.
Okay, thank you. And just finally, several families have reported, Minister, that the price of their weekly shop has increased. Is government powerless to stop this, or can you bring in measures to ensure that families who maybe aren't able to earn money at the moment aren't being extorted?
Well, I've not heard any cases of extortion, Chris. Obviously, supermarkets, etc., are able to increase prices in the same way any private business can, but I'm not aware of any extortion issues. If there is any form of extortion issues that people are aware of, I would recommend they report it to the Office of Fair Trading in the usual way. But I'm certainly, in terms of the ordinary shop for the week, I'm not aware of any massive price hikes there. Can I bring Tim in, who's got an extra question?
Yeah, just a quick one. We've heard that the Isle of Man Southern Sorting Post Office had to be deep cleaned over Easter. I've had a lot of inquiries about what do you do with letters that come through your letterbox? Are they safe? Do you need to clean them?
Right, Tim, I'll bring Catherine in on that one.
And my end of the day, from a Director of Public Health, recommend that would not be the case, and viruses don't last that long in that scenario. So we have had some contact tracing work to do in the sorting office, which we will do and continue to do. It's part of the work that we would do, and the testing, contact tracing, following up on what we call cluster investigations to understand where there may be pockets of issues. And ultimately, you're going to hear more of us talking through and talking to specific areas, talking to different businesses, talking to different communities about different areas of pockets of issues that we might be picking up through that cluster investigations, and how might we support them. So there has actually been advice for a number of weeks now in relation to how we deep clean, but also how businesses deep clean, and those recommendations have been placed, as I said, for a number of weeks.
You may also remember, Tim, we discussed at a press conference, I think it was last week, around how long the virus could survive on surfaces. The only evidence around the world at the moment where the virus can survive for what would be called an intermediate period of time is on metal. On most general surfaces, the virus can't survive very long at all. Amanda?
Yeah, just a quick question on testing. People who get texts confirming they're negative for COVID-19 are still told to complete their 2 weeks isolation. What is the accuracy rate of testing, and are there ways of improving on that as this progresses?
In terms of the accuracy rate, I'll get Catherine to come on in a minute. But of course, as with any testing, no testing, I don't think for any virus around the world is 100%, and I don't think it ever will be. The reason we ask people to continue to self-isolate for the 14 days is precisely because you can have, you can have positive negatives and negative positives. So it's very, very important that we ensure that people do continue to self-isolate in case that accuracy is off. Catherine, I'll just bring you in.
We're also doing a double test for essential key workers when we move into that strategy as well, for exactly that reason. So yeah, the minister's quite correct. Yeah.
I'm sorry. What is the accuracy rate? Sorry, excuse me. What is the accuracy rate on our tests?
So we use Manchester. We'd be doing our own testing, as I say, for some time. And then we qualify with Manchester. So we check whether our position is the same as their position. And I'm not aware of any particular issues. What we get more of is where they may necessarily need a repeat test. So they feel there's not enough swab, and that tends to be the biggest issue that we might find. But even then, in my experience of managing COVID the last few weeks and months, it's been a very, very small handful where we've had to do a repeat test.
In terms of your direct question, Amanda, which I think is, how accurate is any particular test, because we know the antibody testing isn't that accurate. In relation to the testing we're doing is swab testing. My understanding, certainly from some of the studies I've seen around the world, is the accuracy is between 90 and 95%, depending on which jurisdictions you look at, from studies that have been done with the World Health Organization.
Thank you very much.
Okay, thank you very much, everyone, and thank you, Catherine, for coming along and joining us today. I'd also like to take the opportunity, as has become customary now, to do some shout outs before we finish to people in our community who are making a positive difference. Firstly, I would like to highlight all the doctors' surgeries that are continuing to work hard to support the well-being of their patients. The Snaefell surgery in Douglas received a special mention via the hashtag Howard's Heroes, while the surgical team at Nobles Hospital would like a shout out for Mr. Peter Duffy on wards 1 and 2. I'd also like to say thank you to all the teachers and support teams at the Island schools who are looking after the children of key workers. They are continuing to work through the Easter holidays and spent time away from their families to ensure our schools could remain open. So thank you to all of them. To the teams at the Department of Infrastructure and Nobles Hospital who are joining forces to prepare Ward 20 for new admissions. Also Ramsey Rugby Club, who have set up a food bank for any families in need at this difficult time and will happily accept community donations. Also, the staff at Sheen Valley Care Home have contacted me and would like to thank Mrs. Moultrie, the home's manager, for all she is doing to help support both staff and residents at this difficult time. She is going above and beyond, leading from the front, and staff wanted to say a big thank you to her for exceptional leadership at this time. Also, shout out for Liz Main, who is running free Pilates classes online 5 days a week, including chair-based exercises for those with mobility issues and illnesses. Finally, I would like to mention 7-year-old Holly Foster, who is drawing some lovely pictures to brighten up the lives of some of our elderly care home residents. Thank you to all of our community heroes. So that brings an end to today's media briefing. I'll be back with you tomorrow when I believe I've got the Department of Infrastructure with me. Thank you, everyone, and good evening.
The global pandemic of coronavirus is without doubt the gravest threat we have faced both as an island and as a nation.
We are working hard to help our island as a community, but we are asking you to help us to help you.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
For your island, for your community, stay at home.
Stay at home.
Stay at home.
Stay at home.
Please stay at home.
Protect your community. Stay at home.
Stay at home.
Stay at home.
Stay at home.
Please stay at home.
Stay at home. For your island, for your community, stay at home.